Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It's hard to believe, but we're celebrating the 10th anniversary of Health Matters radio program. We are planning some special shows to celebrate the milestones, so we hope you'll stay tuned. Let's begin today by thanking our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and of course, our socially distant technical producer, JD D'Angelo, who's been with us since the beginning of the program. Joining me is Brad White, a compounding pharmacist, and our very special guest, Dr. Brad Steineck, Chief Executive Officer at Community Healthcare. Good morning, Dr. Steineck, and welcome back to the show.
Morning, Paul. Morning, Brad. Thanks so much for having me. It's great to be with you again.
The COVID-19 pandemic has impacted every person, every profession, every service organization, and every business. And many would argue that it has impacted none as dramatically as healthcare. The pandemic has forced a change in how we perceive healthcare and ultimately how healthcare is provided. This morning, we're going to talk with Dr. Steineck about how those changes impact his patients, his practice, and what he believes it means for the future. We'd like to remind our listeners that our program is also available on our podcast. Look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So, Dr. Steineck, welcome back to the show. We would like to thank you for your service as a physician, especially in this last year. It had to be overwhelming. Tell our listeners about yourself and where you practice.
Yeah, so I'm Brady Steineck. I'm born and raised in Canton. I'm married to my beautiful wife, Tiffany. We have 5 children, and I've worked with community healthcare now for 10 years, so about the same amount of time you've been doing this show. Uh, Currently, I'm the CEO of community healthcare as well as a family physician. I see patients out of our Louisville location, which is just east of Canton. We have our company has over 15 locations in 4 counties now, and so we're growing and have we're very proud of our accomplishments and our size, and we're looking to keep growing and getting better. So that's where we are.
So, how did healthcare change during this pandemic, and how is it affecting the future of communities' health care?
Well, I think healthcare changed a lot. A lot of things happened that really had never happened before in all of our careers, and some things happened that seem to always kind of happen again. All trends come back around, I think. But for us, so many different things changed. But really, when you look at what changed, it was a lot of the details, the how. But really, the people that succeeded and did well in healthcare were the ones that really never forgot the why that they're here, why they're doing what they want to do, why they're in healthcare, and that we're here to take care of patients first. And so I think if people remember that we're here to do what we're here to do in the first place, that really can guide you in a lot of uncertain times like we're in. And it really guided us. Our mission statement at Community Healthcare is to take great care of our community with compassionate, timely, low cost, high value care at all times. And if we do everything guided by that mission statement, we're going to do well.
You know, in many ways, the pandemic forced us to think about preparedness and flexibility. In the beginning of the pandemic, shortages of protective equipment, and now we're loaded with it. I don't know what we're going to do with it all, but anyway, crippling the supply chains were dramatically impacted. When you look at your practice, what has changed with respect to being prepared?
That's a great point. Thinking about shortages of supplies, equipment, inventories, I think those are things we're much more aware of now. We were blessed and lucky that the health department and other places have helped a lot of local healthcare companies like ours when shortages were going on, where we could still see patients. We've, like you said, though, we're flooded now, and we've definitely bolstered our inventories. We're prepared for anything and have actually more now and more protection and more supplies than we used to, just for that reason. So it definitely forced us to think more about that in the future.
So how did you physicians change your operations during this pandemic?
Yeah, our operations changed a lot. We went from community healthcare seeing almost all of our patients in person, doing a traditional medical practice. We were actually a little bit ahead on the trend of telehealth, which was a really good thing. We had our own custom branded telemedicine app as early as 2019, about a year before the pandemic. And it was kind of frustrating because insurance companies weren't paying us to do telehealth at that point. We were having to charge patients a little bit extra more than we wanted to. People really didn't see the benefit of it when they could come in and see us. And then March 2020 hit, and we were able to pivot on a dime. We went from doing a couple of dozen visits on telehealth every week, across 4 counties, to doing over 1,000 every
Jeez.
week. And we did that in a 2 to 3 week span. We really were able to be nimble. Huge shout out to our operations team, because we switched that very quickly, and we were able to continue to care for our patients. And that was one of the things that we really felt strongly about. We were not going to close our doors. We were not going to deny people access to care. We just wanted to do it in the safest way possible, and to still be that complete medical home for all of our patients. We
So
also did a lot of other
Oh, go ahead.
things. Yeah, sorry, just to expound
No.
on that as well. We did a lot of the physical changes to our buildings. Almost every office now has a patient entrance on either the side or the back, and those are for people who have symptoms or that we're concerned about. We're able to do, we call them backdoor visits, where we can bring them in a back door and put them in the first room they see, to protect the people in the regular waiting room and our employees. We installed touchless doors at every location. We're working on touchless check-in, where you can check in your car on your phone in the parking lot, and we can tell you when you're ready to come in. We've done a lot of things that way, where we're able to just really keep people safe and still provide care.
So with all those things that you've changed, what things were really successful that you're going to just keep around just as everyday practice?
Well, I think a lot of it, most of it actually, and maybe not as in high a volume. So I don't think right now we're not doing as much telehealth as we were a year ago. But what's awesome is that it's now part of the normal mainstream, kind of method of healthcare. And that's really what we're excited about, because as a primary care, complete healthcare provider that wants to be totally comprehensive with our patients, we have so many more options to offer people now. The busy mom, like my wife with multiple kids at home, might not be able to come in and drag them all to the office that easily. And we can do telehealth for her, or for people who have tough work schedules, or those that can't drive, or people that are traveling. We have a lot of truck driver patients that we can see them while they're on the road. So that's been really helpful. And I think the kind of visits we do on telehealth are very interesting. We do a lot of chronic care. It's not just acute care. We'll have people get their blood work done for their diabetes or their chronic conditions, and then do a telephone or video visit with them after the results come back to go over their chronic conditions. And that's been really helpful. Those are things we're going to keep around for sure. We do a lot of care management, where we have RN nurses that are checking on patients who need extra help. That's not going away ever. We feel like that's been hugely successful as well. And we feel like we can even expound on what our care management. We're looking at partnerships with different other companies and healthcare providers, whether it's palliative care, area hospitals. I think this has been a really great way to start a new type of innovation and really providing complete healthcare for people.
Wow.
A lot of things you touched on also affected us at the pharmacy end, and speaking to your example with your wife and your kids, our drive ups were very popular during the pandemic, and still are. You don't have to get out of your car and come in. You can buzz right through the drive up. And, sometimes we get people that joke and want fries with that. But, in all fairness, you could still talk to a pharmacist at our drive up window. And if it's raining, or if you have kids in the car that aren't feeling well, you don't need to truck them in. You can use that or take advantage of home delivery from our pharmacies. So we also had to kind of rethink a lot of processes to meet the needs that the patient wanted. Some patients wanted drive up, some wanted home delivery, some wanted curbside, some, it was interesting how different patients had different mindsets. So we worked hard to to meet those needs. And a lot of times, patients that are having trouble taking their medications, they want them packaged specially in strip packs or things like that to help make it easier to take. So I think a lot of those benefits are going to stay in our pharmacies too. Um, did did you notice anything on your side that benefits your patients from how pharmacies have adapted during this pandemic?
Yeah, the changes you just mentioned have been fantastic. We've noticed patients really like all of those options, and we know that you guys are doing that. One of your locations is a few doors down from my office here, and it's been really helpful for people. Again, convenience of, like you said, doing it in a patient-centered way, and not doing it in the way that's best for us, or for you, but for what's best for the patient. And that's, when you're able to do that, that's truly why we're here. And if we're able to see a patient in a way that's innovative and creative and in their context, whether it's through a phone visit or a video visit or in our office, and then they're able to get treatment through your pharmacy or through, in a way that is delivered to their house or, a drive up or in a convenient way. I mean, that's going to do nothing but help people take better care of themselves. And overall, it's going to increase then the health of the whole community. So, I applaud you guys. It's been being able to be innovative and quick and nimble and learn and change is one of the things that I think is great about coming out of an issue like this. So it's been really good to see.
Interesting. As you talk to our listeners today, what worry do you have for them, and how should they address it?
Well, what worry I have, I'll tell you what keeps me up at night coming out of this, and that is how concerning it was for me to see how much of healthcare actually shut down, in addition to the rest of society. I was very frustrated by that. I got to be quite honest. A lot of places stopped seeing patients physically altogether, and it was whether it was a specialist office, a primary care, and as someone who stayed open and tried to care for our patients during this crisis, I feel like there was a lot of care that could have happened that was either neglected or never happened at all. People that didn't get screenings that they should be getting. So, how many people in 2020 did not get their mammogram, didn't do a colonoscopy that they were due for? I get concerned that we're going to find a lot of advanced cancers in the next couple of years because we missed them in 2020. That's what keeps me up at night. Also, just chronic conditions. I feel like people forgot that they still had diabetes and heart failure and heart disease and high blood pressure. And, the data shows that those patients get sicker and have a higher chance of serious illness or death from viruses and from other things. And so, really neglecting chronic conditions keeps me up at night. We've pride ourselves on specializing in managing those conditions here in primary care and especially at community healthcare. And if you're neglecting those, it's going to affect a whole chain of dominoes down the line. And so I feel like getting back to normal means getting back to also catching up on healthcare testing and management that was missed. And so I feel like that if people listening, if you're the person that didn't get around to doing some of that stuff in the last year, I just really encourage you to get a hold of your doc and say, hey, what am I due for? What am I overdue for? Because those things save lives. They really do.
That's very interesting. Okay, doctor, it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Brady Steinecke, CEO, Community Healthcare. So, doctor, as a business owner and a physician, I can imagine what that must be like. But what do you learn from the experiences of the last year?
Wow. Yeah, it's funny because I wear two hats in our company as the CEO and then as a doctor, seeing patients every day. And I think what was really cool to see in both of those type of fronts is just how resilient and nimble and able our people were as a team. Culture is king, and I feel like the culture that we have of being patient-centered, doing the right thing for people, and not what's best for us. Really, when you're in a difficult situation, it doesn't build character; it reveals it. And so
Hmm.
I'm just proud of our team. And I've seen not just here in community. I'm biased because that's who I'm with, but I've seen it in multiple other healthcare companies and people in the industry, you guys included. Very cool to see people really getting creative, really getting innovative, really being dedicated to what they're really trying to do and changing so quickly to do what they do best. And so I'm just proud of our team here in community as well. We've done a lot of things to come out of this, not just to survive but to thrive and to really further our mission and taking great care of the community that we're in. And so just being nimble, having those daily conversations with people, having a little bit of meeting fatigue, I think, but the communication, over communicating during these kind of times is never a bad thing. And so we've really been able to advance the culture and advance our mission by doing those kind of things.
Okay, so
It was,
I know you've made some adjustments, okay, in your practices, and I guess what goes away and what stays?
yeah, well, I think, as far as, like we said before, I think telehealth is here to stay. And I think exactly how we use it and the role that it has in our practice is still evolving. We did it out of necessity and we did it well, but now we're trying to figure out, okay, how in a non-crisis situation, how do we integrate this? And so we're working on different models of care for that. That's not going anywhere. I think, like I mentioned, I love our side and back entrances. Um, those are fantastic, and we've really increased some of our capabilities. I know in our office we do a lot more of our own advanced treatments of people, trying to keep them out of hospitals and ERs where more sicker patients are. So we had a patient with just a regular stomach virus at the height of COVID that did not have COVID but was dehydrated and needed to get IV fluids. And my nurse practitioner hung a bag of IV fluids in our back room on a patient, and we were able to keep her out of the ER and out of the hospital and away from people that might have made her sicker. And so
Wow.
I think
Mhm.
those kind of things and the innovation and creativity is here to stay. I think, just looking at CDC guidelines, a lot of the mask mandates and, vaccine mandates and things like that, we're just going to keep following those as they evolve. So again, those are becoming less strict, including this week. So again, just really trying to maintain safety. A couple other things that we do that we're probably not going anywhere that kind of came out of this. We really beefed up what we call remote monitoring. We have a program where patients with heart failure that need to weigh themselves daily to tell if they're gaining or losing weight, or people with uncontrolled blood pressure that need a home blood pressure cuff, or diabetic patients that need a glucometer to check their blood sugars. We actually have cellular equipment that we can give the patient that actually then transmits us their results from home, so that we can know what their numbers are and what their data is in real time. And so it's been really cool to help manage our patients from home that way, where if a patient has a bad blood pressure or their weight's gone up and they need their water pills changed for heart failure, we know that in real time and we can call them and say, hey, Mrs. Smith, we see that you gained weight. How are you feeling today? So we're really doing a lot of cool things like that remotely to keep people healthy and keep them in their home. And so again, those things, we love what they've done for our patients. They're not going anywhere.
That's great. That's great that you didn't send that person to the hospital for an IV. I just, I can't even imagine well, I know what it takes to get through the door in the emergency room, and what all you have to fill out and what all you have to do and wait and wait and wait and all that kind of stuff. And by the time by the time I had a bag hung on that gal, and I'm not criticizing them, it would be probably an hour or so.
Well, you're right.
Uh,
And at that time, it was the height of, the ER was probably full of COVID positive patients.
sure,
And
sure.
but yeah, I mean, it's just, for us, it's just about, one of our little sayings is that the right time and the right care, the right time, the right place. And so if we're able to do those things appropriately in our walls, that's what we want to do.
Okay, time for the news, bottom of the hour. Thanks for listening this morning to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We are back, and this morning we're speaking with Dr. Brady Steineck from Louisville, Ohio. And just a quick reminder that Janssen's COVID vaccine is available for our immunization at our Medicine Center pharmacies. We have a lot more to cover this morning, so let's get back to the show.
All right, doctor, what concerns about our local healthcare system going forward after the pandemic?
Well, I mentioned before, just really worried about people who are behind on their care. So that's one thing. As far as the healthcare system, I think just worried, my concerns are that there are people that are going to go back to just business as usual, like it was before. And like I said, with everything that we've been through and what we've learned, we have to go forward from here. We have to be able to adopt faster, better, more patient-centered care. We have to be able to change quickly, even though medicine already is breakneck speed as far as innovation and change. We need to be even faster. And again, just really figuring out how we do things better, but not forgetting why. And that is, we're here to take care of people. We're not here to do what's best for us. We're here to do what's best for the patient. And so getting back to just doing some of the older things that really might not work anymore is what concerns me. We need to move forward quickly and do innovative things. And so those are my concerns going forward, the things that I try to guard against here at Community Healthcare.
So what gives you optimism and hope that things can be better as they were before the pandemic started?
Yeah, I think just the things that we've learned, like I said before, like really being able to do comprehensive care for people, that we can wrap around services that takes care of the whole person. I'm optimistic that we're not going to be isolated anymore. I think, we worried about our infectious and physical health a lot over the last year, but I think people's psychological, mental, emotional, spiritual health might have been neglected a little bit. So I'm really looking forward to making sure that we're connecting with our patients in that way, and really making sure that mental health is something that we really emphasize going forward. I'm optimistic that people are going to be able to get out and get back to doing healthier things for themselves, going to the gym, getting outside to exercise, doing social things. My wife and I my wife's a ballroom dance instructor. We haven't been able to do that in a year. I want to dance again. Those kind of things are give me optimism. And
Interesting.
I think that looking at the whole health of people again is a huge opportunity for us to improve people's lives going forward.
Interesting.
All right. Well, from masks to vaccines, what tips would you offer our listeners to stay healthy?
Yeah, I mean, I think really it's getting back to basics. I think we were so worried about, again, exposure and infection, and rightly so. But thinking about, okay, what makes me susceptible to infections or to healthcare problems, and getting back to basics of, am I getting enough sleep? Am I eating healthy? What's my weight? And a lot of us gained weight at home over the last year. Are we exercising? Are we doing the things that we enjoy? Do we have social networks that aren't just on a screen? Are we seeing people? Those basics I feel like they've been highlighted to us when we didn't have them. Once we lost them, we realized what we had lost. And so I just encourage people to get back out there and do those things. Again, follow guidelines, be safe, follow what the current guidelines are, but trying to get back to doing healthy things for the whole person would be a huge tip. And just being mindful of people. We know a lot more about who the high risk patients are now. Obviously, we knew at the beginning that elderly over 65 population is particularly vulnerable, but again, we've seen a lot of young patients get really sick or even die because they had chronic conditions that weren't taken care of. And so really just looking at turning over a new leaf, if that's you, if your weight is a problem, we've really learned that that was a huge risk factor during COVID infection, and looking at your high blood pressure, your diabetes, your heart disease, and really getting those things under control, because again, those kind of things really were huge risks as far as complications and severe illness, and looking at risk of hospitalization. And so getting back to basics, getting the basics done, and then taking care of your chronic conditions, huge things that can keep you healthy going forward.
Interesting.
So let's talk a little bit more about vaccines, and I'm thinking about the upcoming flu season, because it's not far away, since it's already June 1st or June 4th. I worry that there might be some hesitancy for patients to get the flu vaccine if a patient received a COVID vaccine this year. Can you address how COVID vaccine impacts a patient ability to receive other vaccines?
Yeah, as of now, the data out there really shows that it doesn't affect your ability to receive or positively benefit from other vaccines. And just remember, influenza is a different virus than COVID-19, and flu vaccine, as we know, isn't perfect, but there's good data over the last multiple decades that influenza vaccine decreases the risk of severe illness from flu and death and hospitalization as well. And we really had a light flu season this last year, and I think there were several things. And again, a lot of this isn't totally, hasn't been proven yet in the data, but anecdotally, I think that number one was that a lot of people were not gathering together, and that decreases viral, at least flu virus transmission. And we probably didn't test for influenza as much as we usually do, because everybody assumed or tested for COVID first. And so the light flu season that we had may or may not have been truly that light. I don't think we know that for sure. But flu season, again, when we have a more like normal year coming up, could still be a threat. And so I think, just talking to your primary doctor and figuring out what works for you, and what's beneficial is a really important thing.
Interesting. I'm curious about the telemed, so I have not used it. Okay. Is it typical in a telemed visit that the patient tells more than when they're in front of you, or less?
In my experience, it can be both. If I had a televisit with a 17-year-old patient, that his mom really was the one that wanted him to talk to me. And as you can imagine, that was kind of a one-sided, I'm asking questions and I'm getting, yeah, no. Yeah. And you can hear mom in the background, say more, talk to him. But a lot of the visits have been really the opposite. People were more comfortable, whether if they're home or if they're, I've had some people at work where they couldn't get off work. So I said, what time's your break, or when's your lunch? So those were, and people, when they're comfortable in those environments, they're able to tell you a lot. And, we always joke too, like we want to use it a lot for chronic care. Like I said, if you do your blood work this week, so we can check your blood sugar, and then we do a televisit next week, I joke with my nurse practitioners. I say, hey, make them show you their refrigerator. If their blood sugar's up, make them show you what they're eating. If there's Twinkies in their cabinet, in their cupboard, then you got them, And so I think those are really cool things. We're able to see people's homes. We're able to see their context, where they live, and sometimes their families there. And those are really cool things. The other thing about telehealth that I didn't really get until we did it is the impact of bringing it into your office. So let's say that I have a patient with dementia, and maybe they're still living alone and kind of on the edge of their children getting worried, or I'm worried, and I can bring my phone in and do telehealth with the daughter or the son, and we can talk together as a family unit, as a team, on hey, how's mom doing at home? Should she still be driving? How are things going? Has she fallen lately? What's going on? And so it's a great way to get more information from people. Again, when it's used correctly, and I think we're all learning pretty quickly that we have a lot of potential to use it for that. So
We owned a property down the street here years ago, and I went into the house, and there was a couple elderly people, and they opened the refrigerator, and they had a beer tap in the refrigerator. And I thought, how many beer taps did you run into on these telemed calls? And I looked at that, and I thought, oh, you got to be kidding! This is nuts.
yeah. I think the funniest things were just in Zoom meetings like this. People that forget to mute themselves or leave their camera on. I think we've all had those stories as well over the last year. So.
In a riot. Why don't we take our last break a little early here? You're listening to Health Matters with the Medicine Center Pharmacy program. I am your pharmacist, Paul White. Thanks for joining us. And here we are back to the show. So, Doctor, you mentioned patient-centered care as being important to both increasing in quality health care and reducing costs. To us in the pharmacy, that means knowing your pharmacist by name, knowing your medications, and why are you taking them. And a lot of people are taking medications, don't know why they're taking the medications, which kind of slays me. But and you know, pharmacists are part of the healthcare team and contributing to the wellness of our patients and customers. What does patient-centered care mean to you as a physician?
Yeah, well, patient-centered is the number one tenet of our mission statement and how we run everything we do at community healthcare. And I think it's really easy in healthcare to make it about yourself. I think, not to get too deep into it, but I think even how we're trained sometimes, we forget why we're really here. And we have to remind ourselves every day that we're here for patients first. And that means everything you do should be meant to make someone else's life better. Not what you want to do, but what they want to do. And really fighting. I think the word fighting is really important. To fight for the highest good of the person sitting across from you, and that can mean a lot of things. But to really just try to fight for what's best for the person in front of you, for every patient. And we take care of a large population. There's other groups in the area that take care of patients like we do, tens of thousands. We have 70,000+ patients that come to one of our offices for their care. And, it's really treating everyone like family, treating everyone like we want our family or ourselves to be treated. And, that's really, the more we stick to that and the better we are at that, the better we do. And it's amazing how everything else follows, whether it's our job satisfaction, our efficiency and how good we are at what we do, even our financial performance can improve just by doing what's best for the patient. And so that's really what we try to do. And I like what you just said in your question about the team. One thing, we are a huge believer in what's called team care. And that includes pharmacists. It includes our medical assistants that are calling and rooming our patients. That's our nurse practitioner team, which is indispensable to what we do here. Our administrative team. So we have a strong group of administrators and managers who really help us do better care and take a lot of work off of the doctor's shoulders and put it on the staff. As far as outside our walls, we do have partnerships with pharmacies where pharmacists can give recommendations to us on, hey, this patient's meds they have interactions, or hey, this person has this medical problem and they're not on this medication that's been shown to help that. So pharmacists on the team is a huge thing. We have RN, nurse care managers that just really use their expertise to help us manage chronic care in our patients. We're looking into partnerships with palliative care groups and hospice groups to help manage serious illness and even end of life care, which can be so important to our patients. We want to have innovative relationships with hospitals and with emergency rooms and with local specialists. I think just really trying to integrate the whole team and trying to break down silos. So when you go from my office to someplace else, there shouldn't be a disconnect between the care you get in my office and the care you get somewhere else. We should all know what's going on with our patients at at all times. And so just really working on that kind of stuff is really the way that we can be patient centered and really do what's best for people.
Do are your physicians pretty much fixed at their location, or they move around?
No, all of our docs basically have one location that they're principally at now. What's great is that as a team, we can help each other out. We have a doc who very happily is having her third child next week. And so next week I'm heading out to our Wadsworth office for a couple half days to help that place out. Several of our other docs and nurse practitioners jump in to help in those kind of ways. And so, but yeah, most of us have one primary location. And then we're free to help each other when we need to.
How many locations do you have again?
16, and
Wow.
11 of them are primary care, like family practice.
Mhm.
We have a pediatrics office over by Jackson High School. The other half of our pediatrics office has physical therapy and occupational therapy. And then further out in Barberton, we have 2 OBGYN practices and a breast surgery practice in Barberton as well. So yeah, we try to be comprehensive. We're looking at even expanding some of those services. So we're really excited. We're really excited about our therapy department. We're actually moving physical therapy to its own location soon. So we'll be looking at rolling that out, and they'll have more space to take care of more people. And we're looking at really investing a lot in our pediatrics. We're looking at really trying to wrap around full developmental care, looking at speech therapy, behavioral health, occupational therapy, developmental testing, autism treatment. Our pediatrics office is extremely innovative, and we're really excited about the future of that office as well.
Go ahead, Brett.
Well, Doctor, we're running close on time. So any final message you'd like to share with our listeners? And be sure to mention, you've mentioned where your offices are, but any contact information you'd like to leave with our listeners today.
Yeah. So again, we are community healthcare. Our website is chci.com. We're also on Facebook, community healthcare. You can find all the locations on the website. My office is here in Louisville, right on Main Street, right down from your guys' pharmacy here in town. Again, we try to cover Stark, Summit, a little bit of Portage and Medina counties, and some of Wayne. We have patients from all of those areas, and we are welcoming new people all the time. One thing I'd just like to leave everyone with is something I mentioned earlier, and that is just to really think about your personal health, anything that you neglected over the last year, anything that you put off, anything that got canceled because facility wasn't open or it wasn't recommended that you do something. Just think about getting caught up. I think that's the biggest message I would have coming out of this and going forward from here.
Dr. Brady Stonick, thank you very much for appearing today on Health Matters. We really
And thanks so
appreciate
much
it.
for having me. I really enjoyed being with you guys.
It's
Thank
always
you.
nice to talk with you. So thanks again, Chief Executive Officer at Community Healthcare. I'd also like to throw a shout out here to Nancy Warmby, who's our Executive Vice President of Medicine Center Pharmacies. She writes all of these programs and she interfaces with all the doctors and all the guests. And she really puts together a sensational program, makes it easy for us. If we didn't have her to write this program, I think we'd be stumbling through many questions and many things. So thanks to the Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and of course, technical producer JD DeAngelis. As always, we thank you listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy.